Hey everybody, it's Dr. King-Mullins, your favorite colorectal surgeon. So our topic of today is what are the causes for colorectal cancer and polyps? So we can divide these easily into non-modifiable, which means nothing you can do about it, and modifiable risk factors, which are things that you can actively do to help decrease your risk. So first things first, non-modifiable. Age, right? So we know now that the age is 45. So anybody that has a colon, so male or female, if you have a colon, at a minimum, you need to start screening at the age of 45. Now, this may be earlier if you have any other risk factors. So the next risk factor is going to be your personal history. And so if you have a personal history of any other cancers, especially if that means that you have a genetic disorder or a hereditary disorder, you may need to start sooner. If you have a personal history of inflammatory bowel disease, so Crohn's disease, ulcerative colitis, you may need to start earlier. And again, those are also non modifiable risk factors. So, family history, personal history, and age, those are our three non modifiable risk factors. So, now let's delve into what can you do? What are modifiable things that can change your risk? So, our non modifiable risk factors are going to include your diet, right? And so alcohol, diets that are high in red meat, processed foods, the lack of fiber. So let's break down the concept of fiber, okay? So fiber, especially the insoluble fibers, your body actually can't break that down. The good bacteria in your colon is what breaks fiber down into literally the fuel source for the colon cells. And so all of these things come into play. So high fiber diet, lots of fruits and veggies, whole grains, limiting the processing of foods. That's going to be a modifiable risk factor for you. Activity. So activity and obesity are actually separate. And so the level of activity, right? And so there are muscles in your intestines, just like the rest of your body needs adequate blood flow. Activity will increase the blood flow to your gut and thereby aid in digestion and the processing of nutrients and the natural movement forward of waste. And then obesity. So obesity in and of itself, particularly central obesity, so around the abdomen or the stomach area, actually is its own risk factor for colorectal cancer formation based upon the way the fatty cells secrete certain hormones or can mimic other hormones that can stimulate um, the formation of colon polyps and cancer. And then finally, as we all know, tobacco is bad, okay, in any way, shape, or form. So vaping, smoking, chewing, avoid it. So that's our brief tidbit today on non modifiable and modifiable risk factors. If you want more information, follow us on YouTube at Colorectal Wellness Center and see our website, colowellness.com. Bye for now.